Anatomy Trains invites you to take your career to the next level with Anatomy Trains Structural Integration, ATSI. We're kicking off the next training this September in Maine under the guidance of Tom Myers and our expert team. Come map the pattern and shape the change in this transformational 3-part certification program. Visit anatomytrains.com for details. Unlock this exclusive 20% discount on all Earthlight products, from portable tables and chairs to professional sheets and oils. Visit earthlight.com, create an account, and enter your ABMP member ID during registration. Plus, enjoy free ground shipping on orders over $75 and a flat rate of $395 for stationary or electric lift tables. Significant savings on everything you need to enhance your practice. Shipping rates and discounts subject to change. We're proud to assist you as the world's #1 brand in massage. Visit earthlight.com.
Hi, and welcome to I Have a Client Who, Pathology Conversations with Ruth Werner, the podcast where I will discuss your real-life stories about clients with conditions that are perplexing or confusing. I'm Ruth Werner, author of A Massage Therapist's Guide to Pathology, and I have spent decades studying, writing about, and teaching about where massage therapy intersects with diseases and conditions that might limit our clients' health. We almost always have something good to offer, even with our most challenged clients, but we need to figure out a way to do that safely, effectively, and within our scope of practice. And sometimes, as we have all learned, that is harder than it looks. Dear listeners, this episode has been languishing in my email box for far too long, and I am happy at last to address it. This comes from a contributor who sent me this story. I have an upcoming appointment with a new client. They've already completed an intake online, and they listed Myasthenia Gravis as an ongoing condition. They're 70 years old, and they also have hypothyroidism and high blood pressure, both of which they noted are well controlled with medication. I did a web search for MG, and it sounds like gentle and nurturing bodywork would be beneficial. For meds, the client only listed Synthroid for her hypothyroidism. She also listed her main massage goal as pain relief and her primary concern as a sore low back and tight muscles. I'm writing in because I can't ever recall having had a client with MG before. Would it be a good topic for a podcast? Well, the answer to that, dear contributor, is yes, yes indeed. I would love to talk about myasthenia gravis, or MG, which means grave muscle weakness. To do this, I'm going to rely on several of my very favorite websites for this kind of information: the Cleveland Clinic, Johns Hopkins Medicine, and the National Institute of Neurological Disorders and Stroke, and eMedicine. You will find links to these and others in the show notes, of course. Are you ready? 'Cause here we go. What is myasthenia gravis? Well, this is an autoimmune disease that attacks acetylcholine receptors on the neuromuscular junctions of voluntary muscles. Okay, let's back up for just a moment. You will recall that there is a connection point, it's a type of synapse, between motor neurons and muscles. And this connection point has a couple of different names. We can call it the neuromuscular junction or the motor end plate, which is the part on the muscle cell membrane. Regardless, what happens here is that the motor neuron spits out acetylcholine. And this connects to acetylcholine receptors on the muscle cell membrane, and this is what initiates a contraction within the muscle cells. A flare of myasthenia gravis means that a person has antibodies that make a mistake, and they kill off the acetylcholine receptors in those voluntary muscle cells. This disease has a few different patterns, but the most common form is when it affects facial muscles, including eyelids. In some cases, it affects the extremities, especially hands and feet. And rarely, but seriously, it can affect the muscles involved with chewing, swallowing, and breathing. How did this immune system overactivity get started? As with many autoimmune diseases, it's not always clear. But one thing we notice is that a lot of people with myasthenia gravis have thymus glands that are active well into adulthood, and sometimes they even have clusters of mutated active cells on those thymus glands. Those are called thymomas or thymus tumors. So now we have to back up again. Does anyone remember what a thymus is? Anyone? Anyone? The thymus is a gland located behind the sternum. It's active in early and late childhood up to late adolescence. And during that time, it is very, very busy training T cells. T cells are called T cells because they are trained in the thymus. So it has a lot to do with immune system function. But for most people, the thymus gland stops being active and it eventually sort of shrivels up and turns into fat or even disappears entirely by the time a person is middle-aged. Because we noticed that people with myasthenia gravis often seem to have thymus glands that are unusually active, we tried simply excising this gland. That's called a thymectomy. And what do you know? Lots of times their myasthenia gravis symptoms improved. And that is a consistent enough finding that lots of patients who don't have observable indications of an unusually active thymus still undergo thymectomy, and we see that this provides some success in treating their MG symptoms. So now I'm a little curious about whether our client underwent thymectomy. It doesn't really make a difference to our clinical decisions, but it's just one of those things I would really love to know. Here's another odd thing about myasthenia gravis. It is diagnosed most often in two populations: women between ages of 20 and 40, and men who are older than 60. It also has ties with some other autoimmune diseases, including lupus, rheumatoid arthritis, and autoimmune diseases of the thyroid, which might become an interesting issue for the client in this story. All right, so now we have this disease. It destroys acetylcholine receptor sites on skeletal muscles, mostly in the face. What are you going to predict will be a really common sign or symptom of this problem? If you said droopy eyelids, you win the prize. This situation, which is also called ptosis, P-T-O-S-I-S, is often an early indicator for myasthenia gravis. The muscles that move the eyeballs are also voluntary, so not being able to move the eyes easily or having them be uncoordinated, leading to blurred or double vision, this is another symptom of the disease. And these tend to develop with a pretty rapid onset, and of course, that can be very alarming. As it progresses, more skeletal muscles may become affected, and this is reflected as worsening weakness and fatigue over time. One dangerous consequence of myasthenia gravis is when it affects some of the lower cranial nerves, and this can lead to problems with speaking and chewing and swallowing. A person who cannot swallow safely and reliably is at increased risk for aspiration pneumonia, which can be dangerous. Another serious consequence of myasthenia gravis is a situation called myasthenic crisis, and this occurs when weakness suddenly and severely affects the muscles of respiration. This can require intubation. Lots and lots of people with myasthenia gravis have at least one myasthenic crisis. The good news is we've gotten really good at treating it, and consequently, the life expectancy for a person with well-managed myasthenia gravis is essentially the same as for anyone else. And isn't that tremendous news? Like many autoimmune diseases, myasthenia gravis can run in cycles of flare and remission. So during those flares, the weakness progresses and becomes more debilitating. During remission, some function comes back. There can be some recovery of the neuromuscular junctions, but this is also very much influenced by whether the person is receiving appropriate treatment. What does that treatment look like? Well, as with many autoimmune diseases, it involves some serious anti-inflammatories, especially prednisone and some of its partners. Depending on the stage and severity, treatment can also involve plasmapheresis to remove excess antibodies from the blood, thymectomy, as we've said, and there are a few other options. Other medications might include cholinesterase inhibitors to boost signals from nerves to the motor end plate. Patients are strongly advised to stay away from heat, to exercise carefully to get plenty of good rest, and they're also advised to avoid a whole bunch of certain kinds of medications, including lots of antibiotics, lithium, statins, beta blockers, calcium channel blockers, magnesium, benzodiazepine, opioids, anti-seizure drugs, quinine, several cancer drugs, and a long list of others. That can be very, very limiting. Well, that's a lot of information about this very interesting disease. And I've left out a whole bunch because knowing the 5 stages of myasthenia gravis will probably not include your quality of life. But where does all this leave us with our client? We know that MG can occur on a wide spectrum of severity. From the description our contributor provided, it sounds like this person's situation is not disabling, and that's wonderful. However, I do have some questions about her blood pressure management. We've been told that she has hypothyroidism and high blood pressure, and both are reportedly well managed. And you know what? I kind of want to know more. She reports taking no medication for high blood pressure, and I am delighted if her high blood pressure is well managed without medications. That makes her life a lot simpler. And I'm curious if that treatment choice is related to the fact that high blood pressure meds are specifically not recommended for people who have myasthenia gravis. And this would include statins and calcium channel blockers and beta blockers. These are all specifically highlighted as pharmaceuticals that can have a bad interaction with myasthenia gravis. Frankly, knowing how she keeps her hypertension under control probably wouldn't make a huge difference in clinical decisions about massage therapy, but it's an interesting question to ask, if only to give her good support and kudos for managing that difficult situation. Beyond that, she's dealing with hypothyroidism, and she supplements Synthroid. This is one of the most common prescriptions sold, and we all probably have clients who use Synthroid, a synthetic form of thyroid hormone. I have to wonder if her hypothyroidism is caused by Hashimoto's disease. This is one of those autoimmune diseases that is sometimes associated with myasthenia gravis. And here's another twist. Hard to manage high blood pressure is often a complication of hypothyroidism. So again, I am just curious to know more about this. That said, she's reporting good health in that department, and I'm willing to take that on face value. The only other specific kinds of cautions I see for someone who has this mild kind of case of myasthenia gravis have to do with exposure to extreme temperatures. These patients are typically advised not to do things like use hot tubs or exercise so hard that they raise their core body temperature and get exhausted. I think it's not a leap then to suggest that this is a client where we might not want to turn on the table warmer, and hot rocks are probably not going to be her best option. Our contributor says that based on what they've learned, it sounds like gentle or nurturing body work would be beneficial, and I completely agree. But let me push back for just a moment. This client says her low back is sore and her muscles are tight, which to me means that maybe some more specific massage might be welcomed. And based on what we've learned, can you think of any reason why not to do it? Because, frankly, I can't. Now, if this client had a more severe case of myasthenia gravis that caused a lot of pain and weakness and dysfunction, then the decisions about massage would probably look a lot different. And this, of course, brings me back to a frequently repeated piece of advice, which is that we cannot rubber stamp indicated or contraindicated for massage. Every individual client is unique. Every individual session is unique, and we must base our clinical decisions on potential risks and potential benefits, and above all, on what the client hopes to achieve. So with these things in mind, I hope now that you feel more prepared to meet your clients where they are including anyone who might have myasthenia gravis.
Massage therapists, are you looking to enhance your skills and improve your practice? Here's your chance. The American Massage Conference is back. This 3-day event will be at Disney Springs in Orlando, May 16th to 18th, and kicks off with Free Friday, which is open to everyone. The weekend has over 20 educators offering approved continuing education and a tribute to the late, great Eric Dalton, as well as nightly cocktail receptions to network and unwind. Head over to massagetherapymedia.com/conferences to secure your pass and join us in connecting therapists globally.